Call this meeting of the Personnel Higher Education Committee together. First item of business is to approve the minutes of the last month's meeting. Motion by Supervisor Simpson, second by Supervisor Leggett.
And I have a question.
Approve the minutes. Okay, we have a motion and a second. Go ahead.
Yeah, thanks. On there, it said Mr. Moore advised when state and federal aid was factored in to increase to the increase to the county budget was $7,500 more than when the two positions were combined. This was in regards to
DSS.
the ESS. That was. This sounds confusing compared to, I think, when you said it.
To what I said, so you want me to clarify it?
Yeah.
So when you, there was an increase with the two positions, there was an increase in the bottom line cost, but when you net out the state and federal reimbursement, the net cost to the county ends up being that figure.
Okay, so net cost to the county is $7,500.
Correct.
When we have two new positions.
That's correct.
Thank you.
So a motion and a second. All those in favor?
Aye.
Opposed? Carried. SUNY Adirondack, we have a meeting scheduled on September 7th, so we'll do our business in a joint meeting with Washington County on the 7th at SUNY Adirondack. Next item of business will be to review the tracking report. Jackie has provided you all with a copy. Are there any questions about the changes to the personnel? If not, we'll go right into Yeager and Flynn giving us an update on the health insurance benefits for 2018 and 19. And Matt, would you like to take the floor?
Yes, thank you. Good morning, all. All right, so what you have in front of you is a presentation that we had handed out. It's on the screen, and it's we provided handouts as well in front of you, whatever's easier to go through. And I'll attempt to use this pointy, fancy little clicker to advance those while I'm talking. Okay, so the purpose of today is to kind of give you a download, a little bit of what's been going on in the meetings that we've had over the summer with the working group. Looking at reviewing costs and trends and the directions, general direction of where things are going out of that meeting. Also to give you what I would say is really a preliminary look at the what the rates could look like, what the costs are looking like for renewal at this point in time, and to enable the county to continue to go forward with their open enrollment planning at this point. So if you turn to the first page, this is all kind of a rolled up, or the second page in. Let me see if that does work. I'll be darned. This is a high-level review. This is all-in costs of the healthcare budget. Okay, so it doesn't back out employee contributions, which you have quite a varying scale of contributions. So on the very top is your current costs. Okay, current self-insured costs. From projecting it through the year end. So December 1st of 17 through November 30 of 18, that means obviously we're projecting a little forward of what claims are going to look like. So the four components, and I know there's a lot going on this sheet, but it'll start to tie in and make sense as we review it. Medical, admin, and stop-loss premium. So that first row is Blue Shield's cost basically to administer your program, pay claims, provide reinsurance, all those types of things. And you can see what that is, 1.386. Paid medical and prescription claims, and that's was estimated to complete the year at 9.8. Just a reminder of your self-insured program, your claims, paid claims, so people's hospital visits, prescriptions, doc visits, labs, etc. That makes up 90% or so of your cost. That's the dominant side of your all rolled up cost. Row 3 of this, medical expense reimbursement plan. This, if you recall from a few years ago, you have a HRA in place to reimburse those employees that have chosen voluntarily to go to a high deductible plan. So that is estimated cost to finish the year at roughly $36,000. And MAPD is your Medicare plan. This is for your retirees that are on Medicare, And again, all-in costs, the great majority of your retirees are covered through a previous contract at 100%. So to give you a sense, we have two carriers, CDP, HP, and Empire, and we've been working throughout the year to find options and ways to reduce that cost. So that all rolls up again, all in without taking employee contributions out, of about 13.4. Okay, as we go down, these next three packets, these next three areas, scenario 1, 2, and 3 are just that. They're gives you some scenarios and options that we've been working on. So first, medical admin and stop loss. At this point, your Blue Shield administrative charges are going to 1.6, and again, this is not final by any means, this part of it. This gives you a, I would say very much a starting point. The reinsurance is bundled in there, and that isn't able to be finalized yet until additional claims come in. A little bit more of an important part of it is, and we'll speak more of it, is the projected medical and RX claims costs. The claims have been trending up. We're expecting claims, if we were to look to anticipate what the following year is going to look like, covering increases in medical costs and where claims are coming from, it's projecting at about a 9% increase on claim costs. We would expect the medical expense reimbursement plan, or better known sometimes as the HRA, to stay the same. Wouldn't expect any change there. What you'll notice in highlight, the Medicare Advantage, if we stay exactly as is with Empire and CDPHP and Empire, that is looking to go down by 20%. So that's scenario 1. Costs go down in that area 20%, or $446,000 in there. So again, all rolled in, if you stay the course with the Blue Shield plan and those two Medicare Advantage plans, you're at just under 5%, okay, for all in total. What the other two are, as you go down, you're going to see in the highlighted section, changing the Medicare Advantage plan to Humana. So from Empire Blue Cross and from CDPHP, leaving those two carriers and having all your Medicare retirees on the Humana plan. I'm going to give you additional backup on this as we go through to show you what it actually looks like on a per head basis, what the rates show up as. But obviously here, it's a significant difference in the rates, significant savings. We do have, we'll go into this in more detail, and I failed to introduce Dave Shantz is here. Dave works with all of our, many of you know him, he works with all of our Medicare plans and retiree plans. He's our retiree coordinator. Any specific, we do have some experience with Humana, and we do, it is certainly, we could say, an aggressive quote, so we have options that we can talk through it a little bit. But if you go with just a one-year rate, that reduces that cost by 53% or frees up $1.1 million or so. Okay, to get overall budget, again, not netting out employee contributions yet, of just under 1%. And the one below it, the only difference to the scenario 3 is that that's a little bit, what I would say, a little bit more of a conservative route, in that the rates have a second-year rate cap on them. So if we're concerned about the volatility, if we're concerned about the big spikes and thinking that maybe Humana might be purchasing or buying the business, that's a little bit of a protection, at least for a 2-year period. The rates are bumped a little bit, and we have a second-year rate guaranteed to exceed no more than 12%. So that's at a preliminary stage at this point. Comparison between what current to where projected looks like at this point in those various areas.
Do you have any questions?
Pausing for questions, yes.
Go ahead.
I'm just trying to understand the contractual obligations we have with employees as it relates specifically to Humana versus the Blues. Are we committed legally? Is there, will the employees still have choice as it relates to Medicare Advantage plans?
Well, I'm going to defer on the contractual part to the administrator. I believe that part of it doesn't speak specifically to the carrier language, but
No, we would have to keep comparable benefits. That's what the collective bargaining agreements say. It doesn't specify a company. We would have to make sure that if we were to switch, that there wouldn't be loss in coverage.
Right, so if, I guess my question, again, comes down to, does the employee, say a retiree, maintain that choice? If we were to go to, I guess make a choice to go to Humana, does that retiree have to do that?
Yes, if we chose to contract only with Humana, then we would move all the retirees to Humana.
Okay, and do we have an option to contract with all three carriers? Well, the Blues as well as Humana and
I think it's either we stay with the two or we go to Humana.
yes. Yeah, it wouldn't work out financially. They charge more when you have three different options. It wouldn't.
And the actual dollars saved by going to Humana, what, in terms of percentage of overall, take our total medical care, if we go to Humana, in terms of percentage of savings, in a dollar amount, what would you estimate as the percentage?
Well, I think we can refer to that what we on this page 2. So as far as when it's all rolled up, it's just going to depend on which option you go with. But if you look at scenario 2, let's say, that is that percentage on the bottom, that's all in with your active employees and your Medicare retirees. So the dollar savings all in, again, not taking employee contributions out, not netting them out yet, but that's about an $88,000 difference from where you are today, or minus 0.66. That answers your question?
Yes.
Okay. Yep. Now, part 2 of that that you spoke to was, if I understand, is access. What changes on the employee side? Like from the benefits, and I'll show you. We'll line them up. They're very, very comparable, substantially comparable. When we talk about access on a national basis, I may defer to Dave, but your two plans today. CDPHP is not necessarily a national plan, where your Empire plan is, and Humana is a national plan in that they pay providers as long as they accept Medicare, they pay them as if they're in network. And Dave could explain it better.
Yeah, the CDPHP actually is a national plan. It's just you're paying more out of network than you are in network. The Humana plan is what's called a passive PPO, which means it doesn't matter if your health provider is in network or out of network, your copay is the same. The only stipulation, as it is with all these plans, is that your provider must participate with Medicare himself.
Supervisor Leggett, you.
Thanks. Matt, on the first line there, medical admin and stop loss premium going up about $220,000. How much is attributed to admin? How much to the stop loss premium?
The breakout, I don't have that level of detail in front of me, but the breakout to memory is going to be about, in the renewal part of it at least, you're looking to be somewhere in the neighborhood of pretty close to an even split. Okay, about 800 or so thousand of it is the actual reinsurance part of it, and the other 800 is admin itself. Again, ID cards, paying claims, adjudicating claims, all that. And that is still being negotiated, that part of it. Unfortunately, the timing of it, we won't be able to finalize today. It's a little bit, being that you renew on December 1st, we don't necessarily have to. Some of this still has to mature a little bit, but we can today give you a ceiling. We can give you what we would consider to be a ceiling or a worst case.
Supervisor Lope, or you got another question?
Well, just a quick one. Is admin a percentage of overall claims?
No, it's a flat dollar amount per employee.
Thank you.
Supervisor Lope.
Thank you, Mr. Chairman. When I look at the MAPD, those people are on Medicare already.
Correct.
in our payments, are we paying for their Medicare Part B?
No.
So, we're paying, we have the Advantage, Medicare Part C, Advantage program. How many retirees are we actually dealing with?
I can tell you right on it. You have
Yeah.
400, and as we go a little deeper in it, we do have the numbers. It's 495 that
500.
are on. Yeah, call it 500.
Even so, that's, I guess going back to Supervisor McDivitt's question about what options we have. That's a lot of money. It's $1 million for Humana, so that's amazing coverage. Well, brings the question, if you have 500 people and 100 of them will go to the doctor's office once a year, they don't mind paying $20. 100 of them will go twice a week, so they would rather not pay anything. Do we have options? Could we have options within, if just Humana? I know United Health, I have United Health. My premium is $17 a month, and I get everything as far as I'm concerned. I just pay $5 visit copay. Is there something we could give an incentive to our retirees to say, look, you don't need to go to the doctors, your choice. If you want this program, which has a higher copay, we're going to give you some sort of incentive. I don't know if we can do that with retirees. That's a lot of money. I mean, I personally, what do I pay? $200 a year premium, and I get full drugs. But I pay $2 for prescriptions as well.
Yep. So,
A lot of money.
speak to part of it. The difference between a plan on an individual basis and a group basis now is primarily made up of the prescription part of it.
Also the benefits. If
Yeah, and the
you're
benefits.
Hospitalized on United Healthcare Plan 1, it's $295 a night for the first 6 nights, and then it's zero after that. If your hospital's in network, if it's out of network, it's $500 a night for the first 20 nights, and then it's zero after that. The benefits, the copay levels are not really equivalent. Any of these plans, CPHPs, Empires, or Humanas, your copay levels are significantly lower than they are with any individual plan. Plus, as Matt said, individual plans have in the prescription drug coverage, the coverage cap, or what's commonly called the donut hole. None of these plans have that.
Yeah, and as far as dual, even having multiple options, one that has poor prescription coverage, let's say, and one that has very good ones, it's hard to put those combinations together because the carriers assume that the healthy people will take the low one and the unhealthy people will take the high one, and it kind of blows the rates up.
Well, I'm looking at it from a personal standpoint that United Health, last year's premium was zero. Prescription coverage was great. $4 copay. This year it's $17, but my copay went down. Again, going back to people love to have incentives. If I could have this gold-plated plan with zero incentive, it's not going to take care of me any better, but maybe you'll offer me some money and I'll take the lesser plan and I'll get the same level of care. Is that something we have an option?
So just to comment on that, it's not legal to incentivize a group plan to an individual plan. Not allowed to do that. You can't offer individual money to get off the group plan and take the individual plan. Medicare guidelines are very strict with that. It's a great concept. You can certainly let people know of those individual options, and if they decided that they didn't want to be on the group coverage, they can certainly drop the group coverage and go out on their own and purchase the group coverage. But the county cannot use money to incentivize them to get off of the county's plan.
Well, that brings up the question. And can we incentivize, I know we do with people who are under the employ, incentivize people to not take the group?
No, The choice that we give to employees is we give them a choice to take a normal plan or a high deductible plan, but it's their choice. We don't lean on them to make that. We can't do that.
It's not leaning. I would never use that word. I say we're all okay. Here's $1,000. Go out and go on your own plan. You know, cost you $500, but now you got $500 to put in your pocket. Otherwise, you've got nothing.
So, so a buyout to other counties do that. We have not done that here, but that's certainly something we could look into.
Supervisor McGowan, you had a question?
Yeah, thank you. I really, looking at this and the different options, it's really, in my look at it, is pennies compared to the increase we're seeing on the medical administration and stop-loss premiums and the projected medical and RX claims. I mean, those are huge jumps to doing this, and we're discussing on, really the different option plans. I'm just a little confused. What really confused me most is that this whole thing with Medicaid, or medical insurance, is that the more people on it, the cheaper it was supposed to become. And, across America here, and it doesn't seem to be the problem here. So, it's getting quite expensive for everyone. Is there, so, here we are looking in between Humana and the CHPs, and I understand that with the different, regular or the high deductible, and that gives you your option of really what that person wants to pay and how they feel that their health is. But is there anything we can do to work on those first two ones there to get those figures down?
So, probably should, we're going to get to that point as we go a little further in proposal, but it'd be a good, that's fine, it'd be a good point at this time to give you some perspective, I guess, in comparison. So, the 9% of the projected medical and claims administration is made up purely of employee utilization. And we went, those of you in the room, many of you recall, last year was our first move to self-insured. Previously, you had been fully insured where Blue Shield held a lot of the risk. And we had asked for a comparison of what that would look like if we had gone back, or had we stayed. And we would be now, and I can, in an email we have it, it's the Blue Shield rates right now would be, if we had stayed in that funding arrangement, we'd be looking at least another plus 20%. Because last year we avoided, in this pile of money, we avoided about $250,000 of ACA, Affordable Care Act taxes, and avoided about another $800,000 of administrative charges. So, it would have been somewhere in that neighborhood. So, one other thing to keep in perspective is last year, when we were going through this renewal, we kept the employees' costs exactly the same. So, in a 3-year period, so we would go back from 16 to what this will look like in 17. It would be, it looks like it's going to look like around 12% over 3 years. So equaling out to 4 a year, which is, well, those of you that insure your employees on a town level, you know that if you could get it at 4% averaged out per year, that's well below national and local averages. But yes, sitting as it sits here, employee use claims are rising. So in the future, things like wellness programs and discussions that we're having on the working group level are going to be important to try to influence that a little bit.
And just one thing to add there on the stop-loss and the admin pieces. The stop-loss contract, and we talked about this when we went to self-insurance, year one it's an immature stop-loss contract. Year two, as it matures, you automatically get that bump in self-insurance because the claims are expected to be higher in year two, because year one, when you start the claims, everything has to ramp up. So the stop-loss cost isn't as great. Now you got to have back-end coverage, on and on. But bottom line is, that every time you go into your second year of stop-loss coverage, you buy a mature stop-loss contract, which bumps that stop-loss premium. So we were prepared that we were gonna have a little bit of a boost in the stop loss.
Supervisor Conover?
Thank you. Matt, so really, in terms of the quotes, the existing plan on the supplement side, it would be $1,780,000, which would be $400,000 less than what we're presently paying in 17. But if you go down to Humana, you see $1,139,000. So if we maintain the status quo, then Frank's going to need to put $600,000 or $700,000 more in the county levy to cover that cost. I just want everyone to understand, to not move to Humana is not $6,000 or $60,000. It's $1,780,000 from $1,139,000. It's a huge. I think I'm reading it correctly, aren't I?
Yes.
Yeah.
So it's just be aware, to not make the move is assuming the companies are comparable, assuming the plans are comparable. You know, we went through a period where we were looking at double-digit increases. I mean, we were just being pulverized on the healthcare side. It's taking, and now in the age of the tax cap, it's taking all, just healthcare alone, which is gobbling up the tax cap. Now, maybe for the first time since I've been here, I would go as far as to say that we should actually seriously consider if the bottom one locks in that rate, and you mentioned a cap. You said it's not locking in at that rate, but you're saying it's locking in the rate of the increase?
Correct. So
The rate of the increase that you're buying for that is what?
max of 12.
Max of 12. And Ron, we suggest that you take that rate cap. Go with a little bit lower savings year one, but lock into that 12%
Option
in the
3.
second year. Because they can't turn around then and take you 20, 30%. You gotta look at those Empire numbers up top and apply some logic to it. They came down 22%, but they wouldn't come down to 50. That says that your claims are up there. So Humana feels, and we've had the conversations with them, because they own their own pharmaceutical benefit side of it, they feel they administer the Medicare better than any of the other companies out there. Washington County, your neighbor, they're on Humana, have been there the last 2 years. It's run very, very well for them. They're very happy with it. They've saved money from it. But knowing from what Empire is doing on their pricing and bringing it down, you know, we're taking Humana's word that they can manage those claims that well. Well, let's see. Let's take that second year rate cap at 12%. We're still going to be well below where we are today on the Empire and the CDPHP, and the county really locks themselves in for 2 consistent years of savings. That's our recommendation, but I mean, it's up to you, but that's what we would recommend.
Any other committee questions on health insurance? Because I do know that we do have to choose one of these to move on to, is it finance or the full board?
Yeah, the full board.
We have to choose one of these to move on to the full board. Supervisor Loeb?
Yes, thank you, Mr. Chairman. Just additional comment on what I was talking about earlier. If in the future we consider a buyout for retirees, perhaps to make it more palatable, we could say, at your young age, you don't need this great coverage. We'll give you a buyout. You'll have some extra money in your pocket, but later on, when you're 80 years old, you want to come back in. No additional cost. So it'll still save us $2 or $3, maybe $400,000 a year if we do the calculation. Maybe it'll only be $100,000. Maybe it wouldn't be worth it. But yep.
We would have to do that analysis and see what the number would be. I think Saratoga County, I don't know if it's still the same when I was there, but it was like $1,800. Westchester County was closer to $5,000. So we would have to do that analysis.
Thank you.
Anybody else? Any other questions? Supervisor Conover?
On that. Those
John
buyouts
Fox.
are for active employees where the plans are north, $20,000 and north. So naturally, if you can have somebody not participate in your health care, go on to their spouse's health care, the savings are hugely significant, so if you provide those incentives. For retirees, on the other hand, what we're looking at here is what's called the Medicaid Supplement Program, which is,
$290 a month, or thereabouts.
Yeah, today
In
it's...
other words, it's significantly less because it's a supplement to Medicare. It's not a full, to fill what they call the donut hole. So, and the other thing to remember on the retirees is that by and large, they're at 100%, whereas, which is unheard of today. Even in the private sector, it's like 50-50, and even our employees are averaging up to closer to 25%. So it's anyone that's retired at 100% is, very fortunate by today's scale.
Another concern on a buyout would be those who currently are not taking the county insurance. That's money out the door to all of them that we're not paying right now.
Okay, so we have option 1, 2, or 3. Do we have a motion by the committee to choose one of these options?
Is there more presentation?
I make a motion for scenario 3, please.
We have a motion,
I'll
and we have a second for scenario 3. You had a question, Craig?
Well, I was just wondering if Matt's finished presenting. A lot of work's gone into this, ain't cut it short.
This is your show, so... But, no, I'm going to let you know what's in here. Obviously, a lot of this we've done a lot of the heavy lifting on it now. But when you go to page 3 and then page 4, this is detail on Empire and CDPHP versus Humana, and you can see it takes those rolled up dollar amounts. That's what it ends up on page 2, and this just breaks it down to a per employee. It's important to say and remember on this side, there's two differences between your active plan. One being that this Humana plan, or even Empire or CDPHP, those are not self-insured. You are not directly paying claims on that one. Okay, that's a fully insured plan. So Humana sets the rates, Humana pays the claims, CDPHP, et cetera, all those. So these are the monthly rates and the breakdowns on page 3 and 4. You can see how it's laid out. I won't go in detail on these 2 pages. I will tell you on page 5 and 6, and I know I just recognize I'm not keeping up at all. On page 5 and 6, is your other plans that don't get as much attention, but it's important to know that your Delta Dental plan that your employees are on to cover their dental care, you have 557 employees on that plan. There's no changes to the plan, no changes to the rate. So excellent news on that side. Same thing on page 6, which is the vision plan. We added a voluntary vision plan last year, 362 people on it and their families, and no change to the benefit, no change to the rates. Okay, so fantastic news there. And then the last page is the breakdown of what the rates would look like. And I want to, and the current rates, I don't want to confuse anybody too terribly with this, but you may recall a few years ago we applied a subsidy, a small subsidy to the Blue Shield rates to get the employee rates to a certain point. So the current rates right there at 666.92 for a single person, that's what they are basing, that's what the payroll deductions are based off of, and that contained a little bit of a subsidy, so that needs to be made up at some point. And that's where the suggested renewal equivalents come from. That's kind of all rolled in at this point. We had discussed the fact that we're still in negotiation, but this would be considered
A not to exceed.
not to exceed.
The maximum.
And we would come back and report to the committee if we're able to get these premium equivalents lower.
And this is, I think it's just important to point out that you see 11.9% here, you see 4% roughly on the other. That's claims, these are equivalents. We want to always build our equivalents a little bit higher than the claims to make sure that we cover. And the fact that there hasn't really been a payroll deduction increase for 3 years now, it's time, because medical trends still keep going. And we recommend that there be some form of premium equivalent increase, not to exceed this, but some form of premium equivalent increase, just to make sure that we keep track so we cover claims as we move down the road.
Any other questions for Matt? Okay, so we have a motion, we have a second to take Humana single option, which includes the second rate, cap, and this is the maximum amount that we would pay. And they're still subject to negotiations. We have motion second. All those in favor, show of hands. Aye. Opposed? Carried. Thank you.
Thank you.
Thank you.
We need another on the premium
Oh, yes.
equivalents on page 7.
We need to, motion to approve, the rates, the equivalent rates on page 7 to the employees. I guess we do. Motion by Supervisor Sokol, second by Supervisor McDevitt. All those questions?
I do have a question, yeah. I'm curious why if we're only increasing the overall cost to us, if I'm understanding this right, by 0.12, why are we charging the employees an 11.9% difference? I know he was talking about that premium bump up, whatever, subsidy. But that seems like, can someone explain it to
Sure.
us?
It's because we get to the .12 through savings on the retirees. So if we're saving money on retiree plans, then the retirees save the money with us. If you look up above, the change on the admin stop loss is 16.
Oh, right.
And the change on the medical and RX is 9.
That's right.
So when those blend out, that's how you get to the increase that's on page 7.
Yep, thank you.
Any other questions?
Chairman, what employee
Employee-
to move?
Excuse me.
What is the motion?
It's to approve the premium equivalents that are on page 7 at a not to exceed, and if we're able to get them down, we'll report back on how far down we were able to get them.
Second call.
You have a question?
Employee contributions, those are all already set, or are they a percentage of premium?
Percentage of premium. By contract.
Up to 25%.
Yes. Some, it's,
Yeah, varies. Okay, thank you.
And I have on the easel there, just for reference, how the costs break out. That's Yeager and Flynn's estimate at the very top for how much our medical, our entire healthcare program is going to cost for 2018. And I've broken out to show you how much the county pays and how much the employees pay. And if you, I went further down and looked at, just the retirees, just the actives, what the shares are. So if there's any questions on that, I'd be happy to answer.
So we have a motion, we have a second. Any other questions about the suggested equivalents? All those in favor say aye.
Aye.
Opposed? Carried.
Okay,
And
thank you.
you're going to continue to negotiate these rates down for us, right? Thank you. All right.
Amanda, do you have a spare pen back there?
They don't know that. Okay, next item of business. Request to amend table organization and create and fill positions of building maintenance mechanic 6, grade 13, base salary of $38,990, and delete positions of airport facility maintenance mechanic, annual salary of $48,558, and then senior airport facilities maintenance mechanic. Oh, okay. These were discussed in the facilities meeting, and Superintendent Hajos gave us a breakout. And basically what he's doing is he's taking a senior airport facility maintenance mechanic and changing the title down to building maintenance mechanic. And he's taking an airport facilities maintenance mechanic and changing it to airport maintenance worker at lower salaries. And it does leave, yes, Supervisor Bramer?
I'll wait till you're done.
We had that on we had a lengthy discussion, and we have I'd like a motion to approve what Supervisor, motion by Supervisor Bramer, second by Supervisor McDevitt. Any other questions about this? I know there was some confusions. Go ahead.
I want to comment that I'm glad that we're deleting those other positions that we aren't using and just sort of making it reflect what's actually happening on the ground.
Thank you. Any other questions from committee? Supervisor Lowe.
Additional information. A lot of the savings, talking with Superintendent Hajos, a lot of savings come from just the fact that his DPW budgeted person is budgeted at a certain grade. When they come over to the airport to do the job, they're paid at a higher grade. So he's maintaining the DPW budget, removing the positions from the airport budget, thus preventing someone coming over to help to be paid at a higher grade.
We have a motion, and we have a second. Any other discussion? All those in favor?
Aye.
Opposed? Carried. Referrals for the Health, Human, and Social Services. Requesting to reclassify the position of account clerk 2, part-time, grade 4, annual base salary of $33,529, prorated to $16.12 an hour, to senior account clerk, part-time, grade 7, annual base salary of $38,328, prorated at $18.43 an hour, effective September 24th. And this is at Countryside Adult Home. Do we have a motion by Supervisor Frazier? I have a second by Supervisor Loeb. Any other discussion? All those in favor? Aye.
Aye.
Opposed? Carried. Okay, DPW. Request to amend table organization salary schedule to create and fill the position of Engineer 1, number 3, annual salary $55,000. Delete the position of Assistant Engineer number 2, annual salary of $46,260. And Deputy Superintendent of Public Works, annual salary of $96,035, effective October 1st. Did I miss something?
No, I'll move this.
You'll move that by Supervisor Bramer, second by Supervisor Lowe. Any discussion? All those in favor?
Aye.
Okay, next, to amend the table organization and salary schedule to create the new position of Environmental Analyst 14, annual base salary of $39,917, effective October 1st. A motion by Supervisor Soko, second by Supervisor Frazier. Any discussion? All those in favor?
Aye.
Opposed? Carried. C, to increase the salary of senior civil engineer position of $73,649 to $83,000, effective October 1st of this year. A motion? Motion by Supervisor McDevitt, second by Supervisor Simpson. Discussion. All those in favor? Aye. Opposed? Carried. Last, to increase the salary of Highway Manager 2 from $73,989 to $76,989, effective October 1st, 2018. Do we have a motion? Motion by Supervisor Bramer. Do we have a second? Supervisor Lowe. And Highway Manager 2 will be the one who will have the signing rights in absence of the Superintendent of Public Works. All those in favor?
Aye.
Opposed? Carried. All right. Support Services Information Technology. Request to create and fill a new position of Computer Help Desk Technician 1 temporary at $21.15 an hour, effective September 24th, 2018, through December 31st, and a total cost not to exceed $3,000. Do we have a motion? Motion by Supervisor Loeb. Do we have a second by Supervisor McDevitt? Any questions? All those in favor? Aye.
Aye.
Opposed? Carried. On the pending items, we have one. There's a lot here. We're going to take this off for next month. We have one. We have one position in a governmental. It's an alternate to the government. We have two governmental position. We have two applications. Mary is reviewing them. One is from the city of Glens Falls. The other one's from the town of Queensbury. And once we make the determination next month, we'll fill that, and then the ethics committee will be full of people. Does anybody have any questions? You want to tell them who they are, and you know better than I do.
I got an email from Catherine Atherton, who is interested, and Robert Curtis.
So we have two applications for the alternate, and we'll act on that next month. Are there any questions from committee? Okay. And the oversight, McKinney, we've already approved these. And are there any questions about the vacancy approved? Is there anything else to come in front of personnel? Ryan? Mary? Okay, do we adjourn this one? Motion to adjourn personnel by Supervisor Simpson, second by Supervisor Frazier. All those in favor?
Aye.
Thank you. Next.